Hi, so let's just have a look at the isolated tibia on its own. We might be able to pick up some of the features that we've discussed so far, particularly relating to the proximal third of the tibia. Okay, so we can see the lateral and the medial condyles, okay, the upper bony prominences which form the upper part of the tibia. We can see anteriorly that they join together to form the tibial tuberosity, and if we turn it around you can see the tibial tuberosity is quite prominent there anteriorly, and then that tibial tuberosity then continues as the shin or the feeling of the shin along the anterior aspect of the tibia. If we turn it around, we're coming into the lateral condyle, and you can see there is the articular surface that will articulate with the head of the fibula. If we again come back to anterior position, you can see that the lateral condyle, the one with this articular surface on, that lateral condyle overhangs the shaft of the tibia to a greater degree than this medial condyle. If we look now above, we can see the two articular surfaces. We can see the lateral articular surface and the medial articular surface that will articulate with the distal femoral condyles. And you can see right in the middle of the upper surface of the tibia that tibial eminence, that raised section just between the points there of the articular condylar surfaces. And that's the tibial eminence. And remember, we talked that tibial eminence is on either side has a raised ridge in a sense, which forms the medial and the lateral intercondylar tubercle. So that superior surface of the tibia, often referred to as the tibial plateau, a flattened portion, flattened with those articular surfaces, but then raised in the middle as the intercondylar eminence, and then the intercondylar tubercles, the lateral and the medial tubercles, immediately either side of that eminence. If we turn the tibia round now, again, we see that soleal line, which gives a very important point of communication and connection with insertion points for muscles of the posterior aspect of the tibia. And we know that just above the soleal line, the popliteal muscle will insert at that point. So those are the features, the bony features that we can see on this isolated tibia, and certainly the upper third of the tibia that we've had a look at.